Welcome to Heart and Health. Join host Larry Micarenda and Dr. David Kavesteen as they talk about heart disease and how it affects our health. Please feel free to visit our website at heartandhealth.com.
With us today is Dr. David Kavesteen from Heart and Health in Middle Island, Babylon, and Plainview. And he's going to help us celebrate Heart Month by giving us some knowledge into some of the questions that we might have. Dave, it's great to have you on. I know your busy schedule. Cardiology is, going to definitely keep you hopping. But this is American Heart Month. We are celebrating it, and through you and your generosity, have offered to help us out, answer some of the public's questions. The last time we had you on the program, people were just writing in all sorts of questions. So we're going to try to go very basic to, some of the mid-level questions. First thing is, what is cardiovascular disease?
Cardiovascular disease is a systemic disease that affects the whole body. And to put it in simple terms is think of body as your house, and the plumbing as the arteries that runs through the plumbing system in the house. And as time goes by, the plumbing system gets eroded and gets over time. If you put a lot of oil through it, or you have a high pressure system, the plumbing system gets affected and clogs up. Cardiovascular system is a systemic disease that affects the whole body. Every vessels and arteries in your body could be affected as we age, and there is a plaque formations through these arteries that prevents the blood from flow easily through the arteries and bring oxygens and nutritions to the organs that they rely on.
Now, we talk about plaque in the system, like we always hear plaque referring to dentistry, which is like, I guess, gunk in your teeth. Now, what is cholesterol?
Cholesterol are fatty substances that your body makes and also body absorbs from the food that we eat. 70% of the cholesterol in the body is produced by the liver, and 30% is from the food that we eat. So if you eat a fatty food all the time, fried food, the cholesterol level goes up. However, the term cholesterol or total cholesterol is referred to the total amount of these fatty droplets that run through the bloodstreams. Nevertheless, it breaks down to multiple different layers, such as a good cholesterol, bad cholesterols, and triglycerides.
Now, what are triglycerides? Now, because a lot of people say, well, it's not all good and it's not all bad. It's more of a precursor of what could be. Is that true?
That is exactly correct. Triglycerides are, think of it as a cousin of cholesterol. It's related to cholesterol, but it's not cholesterol itself. Triglyceride is like a vesicles that carries the food and nutritions from your gut all the way to your liver. And your liver, the cholesterol synthesis takes place, and your body makes most of the cholesterol. So they are like a cars carrying nutritions and minerals from your gut and from the food that you eat to your liver to be digested and metabolized. The high level of triglyceride is usually related to metabolic syndrome, being obese, being overweight, and also a precursor to diabetes. All these syndromes and obesity and diabetes or metabolic syndrome are usually related to not being able to metabolize food and digest food, and to do at times with genes and DNA.
Now, also, we've heard so much about sugar being like one of the bad enemies and everything. So somebody who had like maybe a lot of sweets or something like that, wouldn't that affect their triglycerides level?
No, sweets are not really related to that. It's actually what happens with if you eat too much carbohydrates, too much sweets, too much sugar, your blood sugar goes up, and that's basically makes the diabetes to flare up, and your body not being able to use the amount of the glucose that runs through your bloodstream to digest.
So triglycerides are different than just having a very sugary diet.
Correct. Triglycerides are usually directly related to the how much fat is in your food that you eat. However, if you eat too much carbohydrate, you become obese. You basically convert carbohydrate to glucose and glucose to fat. And as you store more fat and become obese, then it's harder to metabolize food, and metabolic syndrome happens.
Now, what's the difference between with high blood pressure and heart disease? Do they go hand in hand? Is it really true, or can you have one without the other?
Yeah, cardiovascular disease or heart disease are directly related with few risk factors. Diabetes is one, hypertension, high cholesterol, smoking, and family history. Those are the major risk factors for having heart disease. Diabetes, the way it works is because you're not able to control the blood sugar in your bloodstream because you're not able to either produce enough insulin or digest the sugar. Your blood becomes very sticky and becomes very glossy. We look at the level of diabetes not being controlled by hemoglobin A1C. That's a simple blood test that we do. And this test tells us that within past 3 months, how your body has been controlling sugar. So if your hemoglobin A1C level is high, that's basically indication that that you're diabetic, and that directly relates to increasing the risk for heart disease and producing those plaque and clogging those arteries and the whole plumbing system that I was trying to refer to.
We talk about lifestyles and stress. Now, it's very possible that we could have somebody who's in a very stressful job. They eat right, they exercise regularly, their heart's fine. You could have somebody who's in a very less stressful job, who doesn't exercise, who doesn't eat right, and their risk factors are off the scale. So do lifestyles and stress have a bearing on our coronary system?
Absolutely. When you're under stress, your adrenal gland secretes those epinephrine and norepinephrine hormones, the fight and flight hormones in your body. And what it happens is your body is evolved to react during the stress time by increasing your blood pressure, your heart rate, and also diverting more nutrition to your brain because you're stressed, right? You want to be able to be reacting faster and being able to either run away or fight. So what happens is these hormones get secreted and go through your circulation. So as a result, your blood pressure goes up, your heart rate goes up. And we know directly that high blood pressure is directly related to cardiovascular disease. You know for a fact that, you hear every so often that somebody, because of the stress, they had a heart attack and they die. And the reason for that is because of these surges of hormones in your body during those stressful environments and times that causes the heart to work faster, harder, and potentially cause harm.
Two of the other things that have come up. One question was that a woman had went to a doctor and her family physician said that she had an irregular heartbeat. Does this put her at more of a risk for a heart attack?
So irregular heartbeat is when your heart beats obviously irregular, right? So the way I go back to my house analogy, if your arteries and your heart is the plumbing system and your pump in your body, your pump works with electricity. So those, such as your heart needs these impulses of electricity to go through it, so it's going to be able to pump. So I call the electrical part of the house similar to electrical conduction in the heart. So if your heart is beating fast or irregular, it just simply means the conductivity and electric component of the heart has a problem. Now, you mentioned that person was a woman who asked that question, and depends to the hormonal changes during the monthly cycle of the woman. This palpitation could increase and decreases because your whole body is connected together. So the increased surges in estrogen and progesterone could potentially increase those palpitations. Now, palpitation falls into two different categories: the ones that they are harmful and the ones that they're not harmful. We all feel palpitations at times because we are human. We respond to the environments, we respond to news, we respond to many different factors in life. And as a result, your heart rate goes up and down, and sometimes it skips a bit. And you hear it that, my heart just skipped a beat. And that skipping beat or those extra beats that sometimes doctor explains to you are very benign. Nothing happens, nobody dies from it. However, there are some arrhythmias that are dangerous and could put the persons in a situation that they could lose consciousness or they could pass out. However, does the palpitation cause heart attack? No. However, palpitation could cause the heart to work irregularly, and as a result, the heart is not going to be able to pump enough, and the blood pressure drops, and the person could pass out and become unconscious.
So what's the difference between having an irregular heartbeat and having a heart murmur? Because a lot of people, and we've discussed this on the program before, that a murmur has more to do with valve movement. Mm-hmm. Could you explain that to the audience?
Sure. So the palpitation is basically about how your heart beats. So look at your heart as a pump. So the pump is going to go beats like 80 times per minute. And it goes up and down, goes to 80 to 90 to 100, or goes down to 60 or 50s when you're asleep. Now, palpitation is to do with electrical component of the heart, right? How your heart beats. However, murmur, on the other hand, is the sound. Murmur is the sound that is basically produced when the valves of the heart are closing, and they're supposed to stop the blood from returning back to the heart. However, if the valves are not completely closing, the blood comes back in, leaks back to the heart.
So it's almost like a backup in the plumbing, like you were saying, right, with sewage and stuff like that.
Now, it makes noise, so it makes this specific noise, and that noise is called murmur. Now, this is a typical murmur that I'm explaining it to you. So to put it as a whole, murmur is the sound that produced by moving the blood from one side to another side, right? Like a leak, like having a leak in your tire or having a leak in a balloon makes those hissing sound. However, in child, or if the child is just recently born, these murmurs could also be produced by congenital heart defect, and that's something much more intense and involved that it needs to be evaluated. However, in older age, in mid-age women or men, the murmur is usually produced by the leaky valve.
Now, for the young people that are watching, a lot of them feel, I'm young, I'm strong, I'm Superman, but unfortunately, Dave, what we have seen during the past 5 to 10 years is seeing more of these heart attacks on the field with students who are out there exercising, some students just walking into the hallway and just dying. Does age, does the heart disease discriminate with age, or it can kill anybody?
Heart disease, it kills a lot of people, and you know it, and everybody knows it. The truth of the matter is heart disease can be preventable. Think about how we were able to discover antibiotic and being able to prevent unnecessary death from pneumonia or any type of infections, because we discovered penicillin. That happened, years ago. Now, in our time, we are able to prevent heart disease. How are we going to prevent heart disease? We can prevent heart disease by early detection, to finding out what are the risk factors, can we modify those risk factors, and also to find out and get the patients that they are at risk for heart disease, and don't let it to get in too far, because we can do so many different things before the patient has a heart attack and getting to the hospital. But when the patient is having a heart attack and coming middle of the night, 4 o'clock in the morning with a crushing chest pain because they woke up and they can't breathe, and you have to perform emergency procedures, and the time is the essence, it's a little too late.
It's really like the bottom of the ninth in the ball game.
Correct. It's too late. However, can we prevent heart disease earlier on, and as a result save more people, cheaper and less painful and better? Yes. So I think that's what I'm comparing, what the evolutions and discoveries that had happened in the field of cardiology in our time compared to about a few decades ago when we discovered penicillin, because now we can detect heart disease. We can look at the heart by echocardiogram. We can do the stress test. We can see if there is a blockage in the arteries. We can see if your plumbing system needs to be roto-rooted or cleaned up. So there are so many different things we can do to prevent these unnecessary deaths. It's simple, it's easy, and it can save a lot of lives, which I think is very important.
And again, to some of the young people that are watching the program, these heart attacks can also be an hereditary factor. You can be walking around with a time bomb in your chest and not know it. It may explode when you're 16, it may explode when you're 30, maybe 50, but it's there. So hereditary diseases of the heart definitely travel along the family lines.
Yes, we know that DNA and genes are a direct relationship with heart disease, and it's considered to be one of the main risk factors for having a heart disease. So, if somebody has a father who died very early on, like at age 40s or 50s, they might have the genes that his father had. Or if a woman, especially a woman, had a heart disease earlier on in the life, most likely is genetically related, because we know earlier on women has less risk for heart disease than later on after menopause. So genes are directly related to this. We also know that diabetes and hypertension and high cholesterol are also at times genetic, and genes are directly related to those diseases too. So if somebody had a family member, close family member who died from a heart disease, should they be evaluated for heart disease and possible genetic testings and genetic follow-up? Yes. I think that puts them in a higher risk than general populations, and put them in a higher risk than somebody who doesn't have that genetic factors in their genetic pool. So paying attention to see where you came from and who if your parents, your grandfather, if they died early in their lives from a heart disease, yes, you need to be evaluated and treated if it's necessary.
Now, Dave, also one of the biggest things is, as we were saying before, this is American Heart Month, and heart attack rates have doubled for women over the past 2 years. Now, can some of these hormone replacement therapies that some of these women over 50 or something are taking, can that actually help them prevent heart disease?
That's a very good question. Can it prevent heart disease? There are many different things that can prevent heart disease. If you not being overweight, eating a smaller portion, and walking 20 minutes a day, that decreases the risk factors. Monitoring your blood pressure and making sure your blood pressure is well controlled, that's a prevention that can be easily executed and done. We have a very fast lifestyle, and we eat in fast foods. Fast foods are usually made of bad oils and very high in energy and carbohydrates, and it increases the risk of metabolic syndrome. And as we get bigger and we get more obese, then we have a harder time to digest and a harder time to use the glucose and the regular minerals, and it becomes a whole cascade of events. Then diabetes comes in, and hypertension, and as a result, the arteries becomes clogged up, and you have those plaque formations in your arteries and your brains and your kidneys, and the consequence of those blockage are severe. For example, if the plumbing system, remember, if you clog up the artery in your brain, that's a stroke. If you clog up the artery in your heart, it's a heart attack. If you clog up the artery in your kidneys, that's a kidney failure. So all your organs in the body, they rely on blood, and they rely on arteries and veins to carry these bloods to the organs and take the waste away from the organs. Any blockage or any decrease in the blood flow affects their function and affects the body as a whole.
Now, we know that there's some foods that you should stay away from, okay? But having one hot dog every 2 or 3 months, a slice of pizza, everything in moderation. And a lot of people don't realize that.
Do you know, Larry, I actually believe that there are two different philosophies of life. One philosophy is like, do you want to live long and be miserable and not enjoy life? What's the quality versus quantity? Do you want to live long, or you want to live a fulfilled life? I think the answer falls in the middle, okay? You shouldn't prevent yourself from the typical enjoyment of life. I think it's important as a human to live life and fulfill life and enjoy the typical things. So if you like the hot dog and you want to eat it once in a while, I think it's fine. However, take the precaution and go for the walk, go for the exercise, okay? If you're having a hot dog, make sure next few meals you eat more vegetables and fruits. Be conscious of it. Don't be, prevent yourself from eating and enjoyment, because I think as a physician, you have to enjoy life. What's the point of life if you're not enjoying it and you be strict? However, I'm not saying go ahead and eat millions of hot dogs. I'm just saying eat it in moderation and pay attention to what you eat and understand how you're going to be able to modify your risk factors for heart disease and live a healthy life.
And one of the things that we have found out, and the American Heart Association has been talking about, is that when you're young, like some possible young viewers may be watching this program, in your teenage years, what you're eating as a teenager will affect you later on in life. So it's very important that, when mom and dad say, have those vegetables, have that fruit, it really is true. It's not old wives' tales. It will affect you later on in life.
Absolutely. What we eat is what we become. I mean, that's one of the oldest expressions, and that you always use it. So yes, if you eat fatty food and junks all your life, obviously you're not going to get the minerals and nutrition that your body needs. We also know that your brain, it continues to develop throughout the early age, and as we get older, we start losing neurons and your brain deteriorates. So if you give it the right minerals and give it the right food, the right environment to grow, of course you're going to be a smarter and better person than if you just prohibit your food and eat junk and eat processed foods all the time.
So if you would like more information on this, you can go to the American Heart Association at www.heart.org, or you can visit heartandhealth.com for more information. And if you have some questions for Dr. Kavesteen, you could email him through the Heart and Health website. Until next time, I'm Larry Micarenda. Take care.
February is American Heart Month. More than 1 in 3 female adults have some form of cardiovascular disease. It is even more prevalent in African American females. Modifying risks such as high cholesterol, hypertension, and diabetes is important in reducing the risk and can reduce the risk by 30%. Prevention and education is key. Please get yourself checked out during American Heart Month. Thank you. And also, have a happy Valentine's Day and a healthy one.
You've been watching Heart and Health. Please feel free to visit our website at heartandhealth.com.